Hey there, science fans. Today, we're tackling a serious topic, malaria. This disease affects millions worldwide, especially in Africa. It's a major health concern, but with knowledge and action, we can fight back. Let's dive in. Malaria is a life-threatening disease. It's caused by parasites transmitted through mosquito bites. These tiny creatures wreak havoc in the body. They can even be fatal. The impact of malaria is huge, particularly in Africa. Children are most vulnerable. It's a leading cause of death in young children. The good news? Malaria is preventable and treatable. What exactly causes malaria? Meet the culprit, Plasmodium parasites. These microscopic invaders are behind this dangerous disease. Understanding them is key to fighting malaria. There are different types of Plasmodium parasites. The most dangerous one is called P. falciparum. It can cause severe malaria. This type of malaria is often deadly. These parasites have a sneaky way of spreading. An infected mosquito bites a person. The parasites enter the bloodstream, then they travel to the liver. There they multiply and mature. Malaria can be tricky. It's a disease caused by a parasite transmitted through the bite of an infected mosquito. Its symptoms often mimic other illnesses, making it difficult to diagnose without proper medical tests. Knowing what to look for is crucial for early diagnosis and treatment. Early detection can significantly improve the chances of a full recovery. Let's break down the common signs. Understanding these can help you seek medical attention promptly. After a mosquito bite, it can take a week or two for symptoms to appear. This incubation period can vary depending on the type of malaria parasite. Fever and chills are telltale signs. These symptoms often come in cycles, with periods of feeling better in between. Headaches and muscle aches are also common. These can be severe and debilitating, affecting your daily activities. Feeling tired all the time is another red flag. This fatigue can be overwhelming, making it hard to perform even simple tasks. Sometimes malaria symptoms are less obvious. You might feel generally unwell without pinpointing a specific cause. You might experience nausea or vomiting. These gastrointestinal symptoms can be mistaken for food poisoning or a stomach bug. Diarrhea and sweating can also occur. Excessive sweating, especially at night, is a common symptom. If you experience these symptoms after traveling to a malaria risk area, see a doctor immediately. Early treatment is essential to prevent complications and ensure a swift recovery. Remember, malaria can be life-threatening if not treated promptly. Malaria has a nasty habit of coming in waves. These waves are called malaria attacks. They follow a cyclical pattern. Understanding this cycle helps us manage the disease. A malaria attack starts with chills, then comes a high fever. You'll also experience sweating during an attack. These symptoms can last for several hours, then they subside for a while. The cycle can repeat itself every 2 to 3 days. This depends on the type of Plasmodium parasite. Without treatment, these attacks can continue for weeks. They can even become life-threatening. Section 5. When malaria turns deadly. Severe complications. Malaria can be much more than just a fever. While many people associate malaria with high fevers, chills, and flu-like symptoms, the reality is that this disease can escalate into something far more dangerous if not treated promptly and effectively. In severe cases, it can lead to life-threatening complications. These complications can develop rapidly, sometimes within hours, making it critical to seek medical attention as soon as symptoms appear. Early detection and treatment are crucial to prevent these serious outcomes. Medical professionals emphasize the importance of recognizing the early signs of malaria and starting treatment immediately to avoid the progression to severe disease. One severe complication is cerebral malaria. This form of malaria is particularly insidious because it affects the brain, leading to neurological symptoms that can be devastating. It affects the brain and can cause seizures. These seizures can be frequent and severe, often leading to long-term neurological damage if the patient survives. Coma and even death can occur. The mortality rate for cerebral malaria is high, especially in areas with limited access to advanced medical care. This form of malaria is particularly dangerous in young children. Their developing immune systems are less capable of fighting off the infection, making them more vulnerable to severe outcomes. Other complications include kidney failure and severe anemia. Kidney failure can result from the destruction of red blood cells, which clogs the kidney's filtering system, while severe anemia occurs due to the massive loss of red blood cells. Respiratory problems and jaundice are also possible. Respiratory distress can occur due to fluid accumulation in the lungs, and jaundice results from the liver's inability to process the breakdown of red blood cells. pregnant women are at risk of passing malaria to their unborn babies. This can lead to low birth weight, premature delivery, and even stillbirth, making it essential for pregnant women in malaria-endemic areas to receive preventive treatment and regular medical checkups. Section 6. Protecting yourself. Effective malaria prevention. The good news is, we can outsmart malaria. Prevention is key. By taking simple precautions, you can significantly reduce your risk of getting infected. Let's explore some effective strategies. When traveling to areas with malaria, talk to your doctor. They can prescribe preventive medications. These medications help kill the parasites before they multiply in your body. Mosquito nets are your best friend in malaria-prone regions. Sleep under insecticide-treated nets every night. Wear long-sleeved clothing and pants, especially during dawn and dusk when mosquitoes are most active. Section 7. Seeking help. Diagnosis and treatment of malaria. Early diagnosis is crucial for successful malaria treatment. Malaria is a life-threatening disease caused by Plasmodium parasites, which are transmitted to people through the bites of infected female Anopheles mosquitoes. The symptoms of malaria can vary, but they often include fever, chills, headache, nausea, and muscle pain. These symptoms can appear as early as 7 days after being bitten by an infected mosquito, but in some cases they may not appear until several months later. If you suspect you might have malaria, see a doctor immediately. Prompt medical attention is essential because malaria can progress rapidly and become severe, leading to complications such as anemia, cerebral malaria, and organ failure. Early intervention can make a significant difference in the outcome of the disease. They'll perform a blood test to confirm the diagnosis. The blood test is a simple procedure where a small sample of your blood is taken and examined for the presence of malaria parasites. This test is crucial because the symptoms of malaria can be similar to those of other illnesses, making it difficult to diagnose based on symptoms alone. The blood test can detect the presence of Plasmodium parasites. There are several types of Plasmodium parasites that can cause malaria in humans, including Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria. Identifying the specific type of parasite is important because it can influence the choice of treatment. It can also determine the specific type of parasite causing the infection. This information helps doctors choose the most effective treatment. Different types of malaria parasites may respond differently to various medications, so knowing the exact type of parasite can help ensure that you receive the most appropriate and effective treatment. This information helps doctors choose the most effective treatment. The treatment for malaria typically involves a combination of medications that work together to kill the parasites and prevent them from multiplying. The choice of medication and the duration of treatment can vary depending on the type of malaria and the severity of the infection. The most common treatment for malaria is artemisinin-based combination therapies, or ACTs. ACTs are highly effective in treating malaria and are recommended by the World Health Organization as the first-line treatment for uncomplicated malaria. These therapies combine artemisinin, a fast-acting anti-malarial drug, with another anti-malarial drug that has a longer duration of action. These medications are highly effective in killing the parasites. It's important to follow the prescribed treatment regimen carefully and complete the full course of medication, even if you start to feel better before the treatment is finished. This helps ensure that all the parasites are eliminated from your body and reduces the risk of developing drug-resistant malaria. Early treatment reduces the severity of the disease and prevents complications. By seeking prompt medical attention and following the prescribed treatment plan, you can recover from malaria and prevent the disease from causing serious health problems. Remember, prevention is also key, so take measures to protect yourself from mosquito bites, such as using insect repellent, sleeping under mosquito nets, and wearing protective clothing. Section 8. The fight continues. Global efforts to eradicate malaria. The fight against malaria is a global effort. Researchers, healthcare workers, and organizations worldwide are working tirelessly to defeat this disease. Their efforts are making a difference. Significant progress has been made in reducing malaria cases and deaths. Insecticide-treated mosquito nets and indoor spraying have been instrumental. New anti-malarial drugs and vaccines are under development. The World Health Organization, or WHO, plays a crucial role in coordinating global malaria control efforts. They provide technical assistance to countries and advocate for increased funding and research. Section 9. Join the fight against malaria. Stay informed and take action. That's it for our deep dive into malaria. Remember, knowledge is power. By understanding this disease, we can protect ourselves and others. Let's work together to create a malaria-free world. Stay informed about malaria prevention and treatment. Share this knowledge with your friends and family. Support organizations working to combat malaria. Together, we can make a difference. Thanks for watching. If you found this video helpful, please like, subscribe, and click the notification bell for more similar content. Stay curious and stay healthy.